Welcome to Families Recover Together, a three-part series on stimulant use disorder brought to you by the North Country Health Consortium's Petra Direct program. This is Part 1, Understanding and Preventing Stimulant Use Disorder. During this presentation, we hope that you will gain a better understanding of stimulant use disorder as a disease, including how stimulants affect the brain and forms of stimulants, as well as gain a better understanding of risk factors and protective factors. So, what is stimulant use disorder? Stimulant use disorder is described in the Diagnostic Statistical Manual, or better known as the DSM-5, as the continued use of stimulants despite negative consequences. Let's explore how stimulants affect the brain. Stimulants, like many other substances, interact with the brain's reward system by stimulating the dopamine receptors. This increases dopamine levels through a slow but steady release. Since dopamine is the neurotransmitter that is associated with pleasure, attention, and movement, stimulant use results in a feeling of euphoria. Stimulant use disorder, like all other substance use disorders, changes the brain. Stimulants activate the reward pathways in the brain, which leads to the development of craving and creates the illusion that the person must seek out stimulants for survival. The brain's pleasure center exists to help us determine what is important to our survival. So, this means that the stimulants become as important as food, water, and sleep. Let's take a closer look at how stimulant use disorder fits the disease model. The disease model exists to help medical professionals diagnose and treat disease. In recent years, it has been established that substance use disorders, such as stimulant use, fit the disease model. The model is simple. It must include the organ or other body part, the defect, and the symptoms. Imagine for a moment that you are skiing and break your leg. Your leg would be the organ or other body part, and the broken bone would be the defect. Naturally, the symptoms would include pain and an inability to walk. You would require medical treatment to heal. Now let's look at stimulant use disorder and the disease model. Since stimulants change the brain would be the organ, the defect would be the stimulant use disorder, and the symptoms would include craving, a loss of control, continued use despite negative consequences, and withdrawal. So what exactly are stimulants? Stimulants come in two simple forms, legal and illegal. Legal stimulants are most often prescribed for treating attention deficit hyperactivity disorder, narcolepsy, obesity, and depression. These medications may include Adderall, Ritalin, Concerta, and Vyvanse, among others. Illegal stimulants are substances that are manufactured and distributed against the law. These may include crack, cocaine, crystal meth, and ecstasy. Unlike legal stimulants, illegal stimulants are not prescribed or monitored by a physician. It is also important to note that many illegal substances are not pure and may be contaminated with other types of substances, leading to an increased risk of death by overdose. Now that we have a better understanding of stimulant use disorder, let's talk about what increases our risk. Everyone is at risk for developing stimulant use disorder, but some are at a greater risk than others. Students, both in high school and college, parents, people struggling with obesity, and those under stressful conditions or deadlines are at an increased risk. But risk is more than just being part of a population. Risk also includes biology, environment, and access. Biology as a risk factor is one that we cannot change, but can be aware of. Substance use disorders tend to run in families, and this is because genetics account for 50% of a person's risk. But this includes other factors as well, including but not limited to developmental stages of exposure to substances, gender, ethnicity, and history of mental illness. Our environment contributes to our risk for developing substance use disorders. A chaotic home life, being a victim or witness to abuse, exposure to a parent's substance use, the attitude of your family and community towards substance use, and peer influence can all impact the risk of developing a substance use disorder, such as stimulant use. Many of the environmental factors in our lives can create trauma. Trauma and trauma responses contribute greatly to developing a substance use disorder. Access is a risk factor that we can easily plan for. Increased access to stimulants contributes to the risk of developing a stimulant use disorder. Access is simple and can include prescription medications and illegal substances in the home, at school, in peer groups, and in your community. But there are steps that we can take to reduce access and create protective factors. Now that we know what increases our risk, let's talk about what decreases it. These are your protective factors. Protective factors are known as the conditions or attributes in individual people, families, and communities that promote overall health and well-being and reduce risk. Protective factors can be internal and external. Internal protective factors are the individual traits and attitudes such as resilience, positivity, self-esteem, confidence, determination, and many more. By nurturing these attributes in the people that we care about, we can help to strengthen internal protective factors. External protective factors are safeguards that have been created by families and communities, such as nurturing environments, positive social connections, a sense of safety, parental involvement, and reliable and trusting relationships, to name a few. Many of us wonder what we can do to create protective factors for the ones that we care about. Here is a simple list of tips to help you get started. Talk to your teens about stimulant use. Lock up medications to remove access. Use doTERRA bags. Locate safe disposal sites. And participate in drug take-back days. Be a reliable presence in their lives. Model the behavior that you expect to see. Nurture their talents and interests. Be a trusted adult. Value their uniqueness. Allow them to grow. Set boundaries and respect their boundaries. Practice active listening. Be involved. Provide learning opportunities and consequences for undesired behavior. And above all, provide a loving environment. For more information, resources, or to schedule a presentation, please contact Ask Petra. Thank you for your participation in this webinar, and congratulations on taking this step to better understand stimulant use disorder.